Good afternoon. Today we'll be answering a question from Nancy from Tampa, Florida. Her question is, if my child had previously a cartilage ear reconstruction for which a TPF flap was used, can a Medpor ear reconstruction still be performed? This is a very good and valid question. Since we use a TPF flap to cover our implant, can we still perform a Medpor ear reconstruction when the TPF flap is not available? There are many reasons why and when the TPF flap cannot be used. For example, if a patient had a prior ear reconstruction with cartilage and the TPF flap was used, or patient had a prior Medpor ear reconstruction with the TPF flap and they got an unsatisfactory result, or if the patient had a trauma or an accident and the TPF flap was injured. Can the patient still get the Medpor ear reconstruction? And the answer is yes. When the TPF flap is not available, we use an occipital fascia flap to cover our implant. This fascia flap comes from the back of the head and is based on an artery that comes from the back of the head called the occipital artery. And we use that flap to cover our implant. So to answer the question, yes, if a TPF flap is not available, we use another flap, the occipital fascia flap, that is a good flap in our armamentarium to cover our implant and perform an adequate Medpor ear reconstruction.